Hey guys, how are we all doing? Welcome to my channel once again. My name is Violet Okolocha. I'm really very excited, and you know why I'm excited? Because this is the end of the series of the dying patient. We've done an assessment on the patient who is dying. We've done a planning for the patient, and now we're finishing with evaluation. Lovely. So I'm excited I was able to finish this series because a lot of patients have been dying patient. So guys, you're going to really learn a lot, and please, I would love to see your plan for the patient and do your evaluation and send to me via YouTube. I'll be happy to watch. And guys, please always comment on my videos. I really like it when I read your comments. Please endeavor to like this video, and if you've not subscribed, those that are not encouraging me, you have to encourage me. All right guys, so I'm only joking. So let's get started. For the evaluation, you have to endeavor to put the patient details. Like we said, she's a 75 years old lady. You know, put the patient's name, put the patient details. So my patient is Mrs. A.B. You know, and put the patient details, put the patient date of birth and hospital number. Now, the next I have is clearly describe reason for initial admission and subsequent diagnosis. So Mrs. A was rushed into the emergency department because she's breathless, she's having shortness of breath, and she is dyspneic. So that is my initial, clearly described reason for initial admission and subsequent diagnosis. Now, the day this lady was admitted was on the 24th of May 2021. And the next one is identify the main nursing needs addressed during the patient's stay in MAU. The first one we addressed was our patient's, or Mrs. A is experiencing breathlessness due to heart failure. Yeah, and the second one was Mrs. A is experiencing immobility due to pedal edema and end stage of what? Heart failure. So identify the main nursing need address. That's your 2-care plan. And the next one is outline the nursing care provided to meet the identified need. Now, when we are doing evaluation, if you've watched my evaluation video, remember we said everything is going to be in past tense because it is recorded that it has been done. Now, so we explained and discussed all aspects of care to Mrs. A, and we gave consent for all intervention, and we monitored and recorded Mrs. A observation every 6 hourly, and we escalated as per News 2 policy. We assessed Mr. A for Mrs. A for mouth care. We assessed Mrs. A for family involvement. We assessed Mrs. A for spiritual needs, and we assessed Mrs. A for frequent turning, you know. And C, we taught Mrs. A to verbalize her concerns, to verbalize her feelings, to voice out. We taught her to voice out. And so anything that bothers her, we taught her to voice it out. And the next thing, we administered all our prescribed medications, and we monitored its effectiveness after 30 minutes. And we referred Mrs. A to the palliative team. See, that's wonderful. If you do it like this in your exam, oh my God, you're top. You're top. When you're done with the exam, you just say, go get my pen ready. All right, so we referred Mrs. A to the palliative team, and we informed Mrs. A's next of kin and family members about her current prognosis, and we informed Mrs. A to use her call bell, and we documented all care as planned. And the next one is outline the patient's current spiritual and family care needs. Outline the patient's current spiritual and family care needs. So we referred Mrs. A to chaplain in order to meet her spiritual need. Now, if you've not watched the video on assessment, go watch it, because she said she's a Christian, and so she needs a chaplain to come pray with her. So we referred Mrs. A to a chaplain or the hospital chaplain to meet her spiritual needs. We involved next of kin and family members in a plan of care, because you know, when a patient is dying, they usually want their loved ones to be around them. So hence we involved Mrs. A family members and next of kin in a plan of care. And we taught Mrs. A family members positive coping mechanism, because sometimes in the recent scenario, when they come to see their relatives in that state, dying so weak, picking worse, and sometimes they are demoralized. So that's why we wrote here, taught Mrs. A family members positive coping mechanism. And the next one is discuss visiting hours with family members and chaplain, because obviously the patient is dying, but you have to discuss their visiting hours. They just can't come in every hour, and stay. So you have to discuss. We're saying this because it's done now in past tense. Discussed visiting hours with family members and chaplain as requested by Mrs. A, because the patient tells you who she wants to see. So discuss visiting hours with family members and chaplain as requested by Mrs. A. Now, discuss with family members about patient's current prognosis, because you usually, in a real clinical setting, you usually should, update them, because you have to update them, not you just call and say patient has died. So you have to update them about how she feels, how poorly she is becoming. So discuss with family members about Mrs. A current prognosis. Guys, I hope we are really getting it. If I'm too fast, forgive me. I'm used to talking fast. So all these I've discussed falls under outline the patient's current spiritual and family care needs. And the next one is document the patient's allergy and associated reaction. So Mrs. A is allergic to penicillin and usually have anaphylactic reaction. So we document that. It's been documented. And the next one is risks associated, at the least identified risks associated with deterioration of patient's condition. I know we all know the risks. So there's risks for pressure ulcer, there is risks for pressure sore, there is risks for hospital acquired infection, there is risks for fall, there is risks for further deterioration, there is risks for pulmonary embolism, there is risk for edema of the leg. Of course, she already had edema of the leg, so edema of the legs. So guys, it's really this simple. It's very simple. So don't forget, like I said, this patient is fully oriented, but however, she is dying. So usually I've talked about outline the patient's current spiritual and family care need. I know we all know that, which is talking about the involvement with our family and with our chaplain, and lists identified risks associated with deterioration of patient condition, which we've all listed. Risks for pressure sore, risks for pressure ulcer, risks for fall, risks for further deterioration, risks for pulmonary embolism, risks for hospital acquired infection, edema of the leg. So guys, thank you so much for watching, and for all those who've been giving me topics to talk about. You are the real super VIP. So thank you so much for watching. If you have any question, please feel free to pop it up. If you don't have question, guys, please just comment on my videos. I really like to read your comments. So please comment, please like this video, please share this video with your friends preparing for OSCE exam. So that's all, and remember to write the date and time of transfer. That will be given to you, because everything I did there is a formulated scenario from myself. I formed it all, just to guide you when you go into and you see a dying patient, because sometimes you go and you see end of life patient who is unconscious, and sometimes you see a dying patient who is alert, so you don't just get confused, and success. I've been really happy because I've been getting a lot of success stories. Oh, I passed. You know how that makes me feel. It makes me feel really excited, and I'm getting a lot of passes, and I'm super proud of you all. Nurses are really wonderful people and intelligent people. So the next thing, after you write your date and time of transfer, endeavor to write your name and your signature and your date. I usually advise you sign first. I usually advise that, just in case time, but for the planning, for the evaluation, is usually complete 15 minutes, but I will advise you sign first. All right guys, so thanks for watching, thanks for subscribing. Please keep sharing, keep commenting, and give me a like. I will see you in my next video, and until then, keep passing your OSCE exam. Bye guys.